It is a very, very special day to be able to be a part of the beginning of this incredible idea. I'm looking forward to the impactful work that I know will come out of the combination of the legacy of Dr. Leah Zallman and the really powerful work that Dr. Jessica Santos has been doing for decades.
The goal of our center is to really produce actionable and participatory, community-engaged research. We're really going to be focusing on the intersections of immigrant justice, economic justice, and health justice. So any research study that is looking at all three of those things, that's where our niche really is going to be.
The center was inspired by two things. The first was Leah's own personal body of research, which was focused on understanding the impact of immigrants, the contributions that they make to our society. And that was really impactful work for informing policy, but also for helping to push back against narratives that are really common in our country, narratives that are false and harmful about immigrants. Then along with that, ICH as an organization has had really decades of experience working on projects that are about immigrant health. So the idea for the center was to build on Leah's research and ICH's experience doing community-based work and bring that all together into a common vision and a common agenda for how we can use research to really improve health and well-being of immigrant communities.
I know what Leah had put into the center because I worked with Leah for some time, and I think it was really important that this work continued and that it continued in her honor, and the fact that Jess has been able to pick up the ball and run with it and really take Leah's vision and make it a reality is just really, really important and really special.
I'm just thrilled that ICH as an organization is able to honor Leah's legacy this way, and I think the center will be able to take leadership and kind of pave the way for moving us forward towards equity for immigrants in this country.
A lot of the work I did with Leah was more using what we call secondary data, so these large government data sets, and we'd use those to answer different questions. But we were really starting to talk about, well, how can we make the work more community engaged? I mean, I think the work that with these data sets is important. It answers a lot of really important questions, but I like the idea of engaging the community more and figuring out, well, what are the questions that we should be asked? How should we go about it? And then how do we share the results to make sure it has the most impact?
One thing I hope for is that the research and the data that we produce kind of in the role as scientists at the center, that can be work that immigrant communities themselves can use for their own advocacy and to take leadership on moving forward with their own priorities, so that we can really kind of equip communities with research that is helpful to them, that they can apply, that they can take leadership on.
The center will be able to do the research to advance and support the passage of legislation that are critical for the day in, day out lives of immigrants.
I'd like to really be working closely with our partners, both advocates and policymakers, to make evidence-based decisions that, of course, serve immigrants as well as longstanding community members. So I think in that realm, if we're successful, we will see policies both at the federal and state level that really advance equity. So there are a couple ways to get involved. The first would be to really get in touch with your research questions. Tell us what you think we should be looking at, examining in your community, and what answers you need to make the decisions for policy and practice that's going to advance immigrant health. We also are looking for organizational partners that want to do evaluations and investigate certain, new programs or ideas or pilots. Our research is important, but it's only as valuable as its impact in the community. So we're hoping that folks will join us and we can do this together.